In today's video, we have a very special guest, Dr. John Keohane, who is a facial plastic surgeon from Edmonton, Alberta, Canada, with over 30 years experience. He's going to be talking about facial plastic surgery, and I will also review kind of the approximate costs. We'll also put Dr. Keohane's website in the description box below. Hi, I'm Becky. I've been a registered nurse for over 30 years now, and for the last 25 years I've been building my business here, External Affairs Medical Spas. Our specialty is aesthetic treatments as well as regenerative medicine, and our goal is to bring you all the latest information on these topics. Please like and subscribe and share our videos, and be sure to put comments down below if you have questions about any procedures. So welcome to our video. I'm here with Dr. John Keohane, facial plastic surgeon in Edmonton, Alberta, Canada. Thank you so much, Dr. Keohane, for being with me here. We just had the opportunity to spend an hour, beautiful in-service on all of the different types of facial plastic surgery, and now we're going to try to recap that in a few minutes. I was just sharing with you that so many of our patients that come in for our non-surgical procedures, they come in and they do this, and they want fillers and Botox to do this. And you were just sharing with me sort of who is that ideal candidate for, maybe if you can divide the face up.
Sure. So I think the first thing we want to remember is that Botox and fillers are complementary to surgery. It's not one or the other. It should be able to use them both together. So the patients who most benefit from surgery are patients where they have a lot of laxity to their skin.
Okay.
There's a lot of sagging in and around the jowl area, underneath the neck. They have a very heavy upper eyelid, maybe a lot of fat underneath the eyelid. So Botox and fillers can't fix that problem. As I think I mentioned with you, the best way to figure out whether you're someone who would benefit from a facelift is simply lay down, tilt your head back, look in a mirror, and just see how much excess skin layers out.
That laxity
here. Right.
Also this.
Correct.
Sort of a pinch test.
If you're seeing very little laxity, then you're too early to have a facelift.
So there's not necessarily a specific age. It really depends on how the skin has aged.
That's correct. So about the earliest that you would usually see people contemplating a facelift would be in their mid-40s.
Okay.
And the oldest patients that we would operate on would be in their mid-70s if they're in excellent health. Realistically, we get a good sense of how we're going to age by looking at our parents. A lot of how we age is purely genetic. Our environment and our day-to-day activities do contribute somewhat, but mostly it's genetic. Look at your parents, and you're going to get a good sense of whether you're someone.
My mom's got great skin. She's almost 80, so
you're going to be very lucky then, right? Yeah. You may not need to do anything.
And so you had, I was using the term facelift, and you kind of corrected me because you don't really use that overall term anymore.
Yeah, so facelift is probably a misnomer. When we do a facelift, we're doing really a lower 2/3 of the face and neck lift. So the more appropriate term would be a face and neck lift. Can I use you as my model?
Please.
Absolutely. So if we were going to look at your beautiful face, a facelift is going to go from below here, down around here, up here. We're lifting the neck here at about a 90-degree angle, and we're lifting the lower part of the face at about a 30 to 45-degree angle.
And we just saw pictures, and I know you've got them on your website, and we'll definitely include Dr. Keohane's website in our description. Beautiful pictures, very realistic. You were talking about kind of patient satisfaction with a facelift.
Well, I think patient satisfaction with most cosmetic surgery is about 95%.
Okay.
Right, and I think you probably find that here. And a lot of times you can almost predict who's going to be happy and who's not going to be happy. We strive to have happy patients. At the end of the day, that's what we write on the chart, is happy. And we want to be writing happy 95% of the time.
And I think, a saying that we sort of have in the non-surgical industry is that sometimes it is people's budgets that can kind of interfere with getting them to that result. Do you find that as well, or you try and figure out who's ready for that?
Well, we certainly, as I think we mentioned before, unfortunately, operating involves lots of professional staff. When we're operating, we have 4 nurses, we have highly trained anesthesiologists, we have people that are cleaning instruments. So surgery
30 years experience as a
surgery
plastic
tends
surgeon,
to be, unfortunately, somewhat expensive. It is certainly more expensive than things like fillers. It's certainly more expensive than Botox. And we do lots of Botox, we do lots of fillers. But I think we want to think of all these modalities as being complementary to each other, right?
So if we can kind of recap on the face. So you talked about brow lifts, which aren't as popular anymore.
Correct.
But more the eye lift.
Right.
Which...
So, eyelid surgery, so the proper term for that is blepharoplasty. An easier term to understand is cosmetic upper eyelid surgery. It usually involves resecting excess skin and fat in the upper lid. And really what you're trying to do is open up the eye and give the patient a more youthful appearing eye. When people have lids that are heavy and they have a lot of fat and fullness in their lower lid, they tend to look like they're tired.
Right.
They tend to look like they're
Older.
sad,
Yeah.
right? It doesn't reflect who they really are.
And then we talked about rhinoplasties, about noses, because you
Correct.
do a lot.
We have a
of those.
very large rhinoplasty practice, and
Okay.
we've always been fortunate to have a very large rhinoplasty practice. That tends to be a bit different in that the age demographic is different.
Younger.
A lot of younger patients. The youngest people that we'll do a rhinoplasty on are 16-year-olds, and I
Okay.
think the oldest person I've ever done a rhinoplasty on was 66.
Okay, yes.
But in general, it's anywhere from teens up into early 30s are sort of the typical rhinoplasty
Okay.
practice.
And then we definitely finished with, this lower 2/3 face and neck lift, which Dr. Keohane said I'm not quite ready yet.
You're not.
But I will be, and I am really looking forward to it. Thank you so much.
Well, thank you very much
again.
for inviting me. As I said, I truly feel that the only way people could learn is to interact with each other. And again, at the end of the day, what we want, what you want and what I want, is we want happy patients.
Well, and
we
I
want
think that-
patients who are
yeah.
happy, they've met us, they've had the procedure done, and then they get on with the rest of their busy lives.
Just like us tonight. Thank you so much.
Thank you.
If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.